CyberKnife is a specialized radiation therapy delivery system that essentially allows us to deliver high doses of radiation with a huge amount of precision. My training in CyberKnife, I essentially trained at the University of Southern California, which had an earlier version of the CyberKnife than what I utilize now. So I've had experience with the CyberKnife system since 2002, would be about that time. The beauty about CyberKnife and the way a lot of times that people are attracted to it is that it's heavily advertised in terms of minimizing potential side effects during treatment. So the side effect profile, though we can't make it nothing, it's not like it's magic, we tend to have less side effects than a normal course, simply due to the fact that we have higher precision, so we utilize smaller margins, so we're actually treating less of the normal tissue that basically is responsible for your side effects. The side effect profile would really be dependent on what area you're treating in the body, whether it's brain versus lung versus liver versus pancreas versus prostate. It's all going to be a little bit different. Actually, CyberKnife is used to treat both cancerous and non-cancerous conditions. It can actually be utilized in the brain to treat conditions such as AVMs or arteriovenous malformations or non-cancerous tumors such as meningiomas. In addition, it can actually treat trigeminal neuralgia as well. In terms of cancerous tumors, it can basically target almost any lesion in the body. It really is going to be dependent on applicability and appropriateness of its use. The length of a total CyberKnife radiation treatment course will generally run anywhere from 1 to 5 fractions, or essentially 1 to 5 days. How many fractions we use is really, again, contingent on the site that we're treating and the plan and how it looks. But in general, I average it out to about 3 treatments for most patients. During the actual treatment on a daily basis, you could expect to be in the center for about 60 to 90 minutes on average for the treatment per day. It's important in today's radiation treatments essentially because it has just a high degree of precision that's really quite impressive. It can actually target a lesion within less than 1 millimeter. So that precision is huge. Also, the ability for it to deliver large doses in a relatively short period of time is quite good. So put those two together, and I really think that CyberKnife is probably one of the best stereotactic radiation therapy delivery systems out there. You can find more information about CyberKnife at tampabaycyberknife.com or at frogdocs.com or at fcpn.com. So we have multiple websites you can use.